Welcome to an hour of HealthMade Radio. HealthMade is a community for natural health seekers where we educate people about common health conditions and share extensive research on the most effective natural health treatments. A core concept belief is in the innate intelligence and healing power of the body, and if properly supported spiritually, emotionally, and nutritionally, it can find its way back to health. HealthMade Radio will bring you information from integrative health experts throughout the world. I am Dr. Michael Karlfeldt, and I will be your host. Today's guest is Dr. Paul Anderson. Dr. Anderson is a world-recognized authority in the field of integrative cancer research and the treatment of chronic diseases, genomic conditions, and autoimmune and infectious disorders. For many years, he has trained students and clinicians at a number of naturopathic medical schools and other higher education institutions with a specialization in intravenous IV therapy formulation and infusion techniques, as well as clinical approaches to complicated illness. His extensive background includes long-time faculty members at Naturopathic School of Medicine, Bastyr University, and Chief of Intravenous Services at the Bastyr Integrative Oncology Research Center, where he led research projects funded by National Institute of Health. He is the co-author of the book Outside the Box Cancer Therapies, Alternative Therapies that Treat and Prevent Cancer, available at Amazon.com and Barnes & Nobles. Dr. Anderson is an authority in the integrative health field that I highly admire and respect. I use many of his protocols in my clinic, the Karlfeldt Center, with great success. Thank you so much, Dr. Anderson, for joining our show, HealthMade Radio. You are someone with a great experience, and you just wrote a book, Outside the Box Cancer Therapies, Alternative Therapies that Treat and Prevent Cancer. I'm just curious, why did you and Dr. Stengler write this book?
Well, that's probably a great place to start. We actually were in medical school at just about the same time. And after we got out into the world, we went to two different parts of the country in the U.S. to practice and really didn't see each other for about 20 years. And then he came to a conference I was teaching at that happened to be about integrative oncology. And we reconnected and found out that we had, over those years, organically developed these fairly large cancer practices. And then we started talking about, how we had gone in different directions that found a lot of the same things out. And there really wasn't a good resource for patients out there to help them find what would be, how to stratify the different natural therapies or integrative therapies and what's best for this type of cancer versus that, and what has good research. So we started to get together and decided to write the book together to bring not only our experience, but just all the research that's come out in the last 20 or 30 years about integrative therapies. And that was the beginning.
Yeah, and what is integrative therapies? I mean, when people think about cancer, you talk about you need chemo, you need radiation, you need surgery. I mean, what is integrative therapies?
Yeah, that's a really good distinction. Most people, and this is actually another reason we wrote the book, because most people in North America certainly don't have access to healthcare providers who provide integrative therapy. And so they're offered the standard care, which is what you just mentioned. Integrative therapies are on a spectrum, and they go all the way from prevention-oriented therapies to therapies that are used during standard, chemotherapy, radiation, surgery, that sort of thing to keep you healthy. But also, I think more importantly, therapies that take care of your entire body, and especially your normal healthy cells. So integrative therapies could be anything from natural supplement type things such as herbal medicine or nutritional medicine. It could be things that you do such as hydrotherapy or heat therapies or IV therapies of nutrients or herbal substances, etc. It's really just about anything else that can affect your body in a positive way. And that's really the goal of integrative therapies is regardless of what else you're doing. We have some patients, for example, who come to us and they're 82 years old and the oncologist says, you're too old for me to treat you, but you still have cancer. And they'll say, well, can I get any other treatment? And the oncologist will say, no, there's nothing for you. And they'll come to us and, we have plenty of things we can do with someone like that. And then on the other hand, someone might come and say, I just finished chemotherapy and I've never felt worse in my life and I really need to recover from that. Is there anything you can do there? And we certainly can, step in at that point and we can step in, if here's another thing that happens a lot. The oncologist will say, well, you have a type of cancer where the treatment's about 5% effective. And you'll for sure get the side effects, but about 5% of people actually get a benefit. Many patients will say, well, I won't take those odds, so is there anything else we can do? Well, that's where integrative therapies really shine because they treat more than just the focus of, say, chemo or radiation or surgery. It's much more broad.
And these can usually be done simultaneously, or does the patient have to choose between doing more the standard of care, the chemo, radiation, or the integrative therapies, or can they be combined then very effectively?
In my experience and also in all the research I've done, almost all of them can be combined to make both therapies work better, the standard and the integrative. What happens with people, and this is another reason that we wanted to write the book to get the story out, is the oncologists will often not know this, and so they'll be concerned about maybe there's some, contraindication to doing the integrative therapy while we're doing the radiation or the chemo. But really, if you have a practitioner who knows, which things go together, most integrative therapies are very complementary to doing the standard therapy. So it's really more a concern that's in the mind of the other doctor than a real concern.
Because frequently I have patients coming in and they're willing to do integrative therapies, but then they're surrounded with family members that tell them that they should just do what the oncologist says, just do chemo, just do radiation, do surgery, because that is proven medicine, and that is what will actually work on the cancer, and stay away from all this kind of strange things like vitamin C IVs and holistic therapies. What's your thought about that?
Yeah, I would say I've had the same experience over time. Really, and of course, most of the time this needs to engender a bigger discussion with the patient and probably the family too. That even if you're going to do something like chemotherapy, radiation, or a combination, what I always tell people is that is a therapy, or those are therapies that are aimed at a particular outcome for the tumor cells. And for the most part, those, whether it's chemotherapy or radiation, it's to try and destroy the cells. The problem being that most chemotherapy and most radiation has a bystander effect onto your normal tissues as well, and that in itself can be problematic. The other part, so integrative therapies can help with that, but the other part is I always tell them there's more cells in your body that don't have cancer than do have cancer. And one of the things we know now that we actually talk a lot about in the book is cancer stem cells can kind of back away from the chemotherapy and radiation and hide, and then they'll go recruit normal cells to become cancer cells again. So if you don't take care of the normal cells in your body, which chemotherapy and radiation don't do anything for your normal cells except harm them, so if you don't take care of the normal cells, they will not be resistant to recurrences of cancer. So we try to promote to the patient, let's say the best case scenario, there's a 90% chance that the chemotherapy works in your type of cancer. we'll say, great, that's fine. Let us support you through that, and let us take care of your normal cells so that the chance of recurrence and the chance of damage to your normal cells or turning them into cancer cells is as low as possible. So it's really a matter of, yes, the system is set up so it has statistics for chemotherapy and radiation, but people don't understand that those treatments are really aiming at a very small part of the problem. And a lot of times once they understand that, they'll kind of take a step back and say, oh, I didn't realize it was necessary to take care of, my normal cells or keep my immune system working through the process. So it's a difficult conversation, but that I've been having for a long, long time with people, but it's very necessary. And I think it more comes from a lack of understanding probably than anything else.
Yeah. Well, I'd love to chat a little bit more about the cancer stem cell theory and the impact of that has. We'll just take a quick break, and we'll be right back with Dr. Paul Anderson. Welcome back. I'm here with Dr. Paul Anderson, one of the leaders in naturopathic oncology. So, Dr. Anderson, you were talking a little bit about cancer stem cells and letting us know that chemotherapy, radiation therapy really doesn't have an impact on these cancer stem cells, but these stem cells, they actually go into hiding, and from what I understand, the chemo and radiation can actually aggravate them and make them more active. Is that correct?
Yes, this is, in one sense, we've kind of known about cancer stem cells for a long time, but we used to call them something else, and we didn't really have the cell biology to understand them. But the way to think about them, which is something that is generally not addressed during standard of care, but we write about it in the book. And this is, by the way, this is not really a theory. This is very well documented in scientific publications, what I'm about to describe. But what we understand now with cancer stem cells is that you can think of a small group of cells like the parents, and then the larger group of cells as the tumor and the children's cells that we're fighting and that you see as a tumor. So what happens is that the parent cells, which are very similar to the embryonic stem cells that became us when we were an embryo, and as we know that we have a stem cell as an embryo, and it can become many different things depending on where it is. Well, it turns out that cancer has the same basic system, which is it has stem cells that can become the cancer, and they are separate from and have different biology from the cancer. So rightly so, we spend effort to fight with the cancer that we see, the tumor, et cetera. And the stem cells then kind of step back, and if you do chemotherapy or radiation, what the research will show is that the chemotherapy and radiation will strengthen the stem cells while hurting the child cells or the regular tumor cells. So it's a different effect on stem cell than regular cell. And in all of the scientific research literally being published constantly now, we wrote the book over about 9 months ago. We had to turn it in, but right up to the time that we published, there were new publications saying this and saying the same thing. We cite all the ones we could in the book. And that is that if you get radiation chemotherapy, we know you're going to have stronger cancer stem cells, even if the chemo and radiation kills the primary tumor, which it often does. So the point that the scientists will say is, well, we don't know exactly what to do with this information because we don't have treatments for it. Well, it turns out that the cancer stem cells are, because of their biology, it's very, very different, and they are more responsive to many of the integrative type therapies. And if you look at chemo or radiation makes the stem cell stronger, the integrative therapies, many of them make the stem cell more quiet or weaker or less likely to do what they do. So the other thing is people, I've had patients say, well, so is a stem cell problem, is it really a big deal that I worry about keeping them quiet, or can they just, can they go away? And the idea is that we don't know if this is something we have our whole life or whatever, but once we've had cancer, we know that those stem cells stick with us. And so it is very important, regardless of what other treatment you've had, that the stem cells are kept in a state where they're not triggered to activate. Because the other thing that they can do, which we, again, didn't used to know, is they can recruit your normal cells to become cancerous, which is why we're so, big on keeping the normal part of your body healthy and the immune system healthy so that doesn't happen. So, yeah, the stem cells are really a complex issue, and they're why people will have successful, quote-unquote, cancer treatment and then have a recurrence of cancer later. It's usually the stem cell that does that.
Because frequently I hear oncologists telling my patients saying, well, let's not worry so much about what happens later. Let's just focus on the cancer that we have in front of us, and that we will treat with such and such chemo or such and such radiation. But what you're saying is that in order to then have a better outcome, we then need to, in addition to treating the cancer that we have in front of us, which sometimes chemo and radiation would be the viable option, but also at the same time we really need to consider then the stem cells that are then brewing behind, so to say, to prevent sometimes even a stronger cancer from reoccurring, which might be even more chemo resistant or radiation resistant.
Exactly, yes. And I think that the discussion, of course, everyone has it differently, that the oncologists have. The discussion doesn't have to be either or, as it is often presented, as you just said. And I think that goes to the overlying philosophy of integrative medicine is we don't have to not do one thing in order to do the other thing, but we should be mindful of future effects on your body and preventing those future effects. And so you could have an aggressive treatment that's very useful for the cancer in front of you, and that's great, especially if you can support yourself through it. But you really should be concerned about making resistant cancer stem cells and other things that would make you more likely to have cancer later. And so usually when we hear that from a patient or whatever, we'll just basically say, look, it doesn't have to be either or. It's, if that's a viable treatment with your oncologist, let's support it, but let's also not have you get cancer again if we can at all help. And there's a number of ways to support this process. But yeah, I think that, people, it kind of goes back to our question of earlier where the family says, well, these are the proven treatments, so stick with those. Well, it doesn't, the proven treatments may or may not be useful, but that's a statistical problem. But that doesn't have anything to do with what the rest of you needs, and especially for preventing future problems. So, yeah, I think it's an education thing for the patient.
Absolutely. And so what type of integrative therapies? I know there's a large number of ones that you use, but a patient dealing with cancer, a family member of someone dealing with cancer, what type of integrative therapies have you seen being kind of the first step or the most powerful tool that you should look towards?
Yeah, it's it's interesting in that since writing the book and putting together, obviously we've got a book that's 300 and some pages long, so there's a lot of things in there, all the way from herbal and nutritional things to IV therapies and diet therapies and all kinds of things, and then a lot of things you may or may not even be able to get in the United States as far as therapy. So there's all these things you could do. But one of the things that I think, we all who have done this a long time have come to, just by watching our patients is there's a foundation that people have to work on in the beginning and kind of consistently. And if they work on the foundation, then the right therapies on top will work better. So let's say, for example, you have a type of cancer that's very responsive to certain mushroom type extracts, and it's responsive to, let's say, vitamin C or curcumin or something like that. If the base has been worked on, and so your metabolism and your epigenome are all very calm and working the way they're supposed to, then those things that the tumor is probably responsive to, whatever they might be in the integrative and natural world, will actually work better because they go into a system that's not fighting with itself. So what I always tell people is there's three big kind of blocks in the base that we got to work on first. And it doesn't mean that we can't do the other things. It just means this is your kind of foundation. And so the first block is food and what they're eating. And food sounds deceivingly simple, but basically food means not only the diet that you consume, which of course is important, and there's different types of diets that may work for different things, but also we want clean food, so the lowest amount of toxins possible, because it makes no sense to be fighting with cancer and getting the immune system working and putting more toxins into your body. That's cross purposes.
Yeah.
Then the other part is, so let's say we get your diet in a better position, it's cleaner food. Then there's the balance within, and for some people with aggressive cancers, we have the balance, in one direction, say like a ketogenic diet. Mm-hmm. In some people who are more in the preventive phase, or they're coming off of, therapies that are very damaging or something, might go a different direction. But then the final thing about eating is the timing of eating, and we can get into this a little bit later, but basically the idea of intermittent fasting, where you have a period during the day where you do eat and a period where you don't eat. And the research around that is showing just by doing that you have less cancer recurrence as well. So food is a big block, what you eat, cleanliness, timing, etc.
Wonderful. And then I would like to, let's chat. We're going to take a little break. And I would love to chat a little bit more about the ketogenic diet, because that seems to be a powerful tool in regards to battling cancer. So we'll be right back with Dr. Paul Anderson. And we're back here at HealthMade Radio with Dr. Paul Anderson, the author of the book Outside the Box Cancer Therapies, Alternative Therapies that Treat and Prevent Cancer. Dr. Anderson, you were mentioning that there were three foundational things that needed to be in place to that allows these other therapies to really work, like mushrooms and IVC and so forth. And the first step, you were mentioning the diet and the food that we're eating. You're talking about ketogenic diet. Tell me a little bit more about that and how that helps someone dealing with cancer.
Yeah, I think that's a really important place to pause for a moment and dig into, because I think it's becoming more in the news or social media or whatever. People are hearing about it and they don't really understand it, or maybe they even get some bad advice about ketogenic or ketogenic-like diets. But the idea behind, to make it real short, the idea behind a ketogenic diet is that it pushes the metabolism in a direction that is very difficult for cancer cells to continue to thrive and exist in. And it does it by changing the amount of sugars or carbohydrates that we normally eat versus protein versus fat. And so it's when we eat in a direction that is a ketogenic diet, we're actually making ketones, which is a byproduct of fat metabolism. And in doing that, what we do is we really deplete the energy stores that a cancer cell could otherwise use against us. So, and of course, there's always more to it than that, but that's the bottom line, is it shifts towards a higher quantity of fat very low quantity of sugars, and then a moderate quantity of protein. And in doing so, the human body is very well set up to eat this way. It's not as scary as it sounds. But in doing so, the chemistry of the body changes, and then your normal cells live quite well on this, and tumor cells become weaker because they don't have the normal chemistry that is, let's say, sugar and insulin based to trigger them and make them stronger. So for many people in the active cancer fight, we do our best to try to get their diet into this direction, so that so we're strengthening the normal cells and taking away potential fuel and strength from the cancer cells. So that's kind of the short version of the ketogenic diet.
Wonderful. You mentioned that there are two. So you have the diet, and then there are two other building blocks.
So with then we got excited and talked too much, I think, about it.
It is very exciting.
As I say, I do the 3 words so patients and my students can understand them, but there's always more than 3 words, right? So I'll just give you the 3 words first, and then we'll go into them. There's food and diet, then there's muscle mass, and then there's your brain. And so muscle mass is simpler. It is the physical counterpart to like a ketogenic or a low-carb diet, and that is, it's very clear in the research that if you have more muscle mass that you build when you have cancer and less fat, you live longer, even if you have cancer. And people have looked at this and said, well, why is this? Well, it's fairly simple, and that is that if we have more fat mass is supportive to the chemistry that is pro-cancer cell, just like sugar is. Muscle mass is supportive to the chemistry that makes it very difficult for cancer to grow and thrive. So we'll work with people, and they will say, well, gee, I just finished chemotherapy and I can barely, stand up. Do you want me to start lifting weights, or what do you want me to do? And we'll say, no, we're working on your diet. We're going to start where you are. So if you're really sick or really fatigued or whatever, we'll say, how many times during the day do you get up and walk around? Well, we're going to start by adding, one more walking event to that. Or if you're feeling pretty good, we'll say, we want you to do some exercise that gets your big muscles, like the leg muscles and the core muscles of the body, working, because we want them to be triggered so their metabolism improves. And then what they do is the skeletal muscle that moves us around actually sends signals out to other cells to say we're going to change the metabolism in the body because this person is physically developing themselves. That actually works that way. That's an anti-cancer strategy. And then the third is our brain, and not just although it's very, very important, the idea of like mind over matter and that sort of thing, but also how we deal with the diagnosis that we have. So if we diagnose with cancer, that no one wants that diagnosis, but it's how you feel about it day to day. So are you feeling like a victim? Are you feeling like you have power over the thing? How is that going? So what we eat, how we work our body and compose our body, and then how our brain is working. So if those 3 things we keep working on, of course we can't change them all overnight, but if we keep working on those and get those working really well, what I found over many, many years is then all my other treatments, let's say it's IV vitamin C or curcumin or all the different mushrooms or nutritional intervention or let's say hydrotherapies or hyperthermia or many of these other things that we do, they work better because the metabolism we're putting all that good stuff into is stable. It's not pro-cancer. So, and basically getting the brain going in the right direction, getting the muscle going in the right direction, and the diet make our metabolism very resistant to cancer, even when it's there. And so then the therapies actually go in, and it's sort of like you're hitting the cancer from 2 directions. If people look, and you'll see in the book later, where I'm telling some stories about research with IV therapy and other things over time. There's one particular, it's very, very telling. It was an early study where there was about 9 or 10 people, I think. But when we looked, and these are people who had no hope, like there was nothing working, and we actually got some to have stable disease where the cancer didn't grow anymore. And all the chemo and every other therapy couldn't do that. Well, when I looked at it, the group of, because they were all patients I knew, the group of people who didn't have positive effect in that trial were, the only thing they had in common is they refused to change their diet. And so it's like there's this great therapy that if it goes into a system that's together and, the diet is resisting cancer and all that, then it seems to work. If we put it in a system where the person's eating as much sugar as they can and, very inflammatory, it doesn't seem to work. And it really, like, I stepped back and I thought, wow, I'm not even though I do emphasize people's diet, I'm not emphasizing enough how important this is to people. So I guess that's something we've learned over time, that we really have to educate people that the ball is in your court as far as how you keep your body anti-cancer, and then we do all these other great things on top of it.
And I have your book right in front of me right now. I mean, it's an amazing book. I just got it last night, and I can't wait just to plow through it. Chapter 7 here, talking about intravenous and injection therapies, like vitamin C. You have artesunate. Talk about ozone, hydrogen peroxide, glycerin, ultraviolet blood therapies, DMSO, glutathione, and mistletoe, and on and on. So my question is, I mean, do these actually work? Are they backed by any scientific research? How many patients have you actually supervised going through these therapies?
Yeah, I think, and that's of course a question we get at the clinic every day. So it's a really good question. In my clinical practice, so let's go back, 25 years, we've had a lot of time to do a lot of those different therapies. But the other thing that's expanded the scope of what I can speak to as far as therapies I've supervised or overlooked is I've been involved in 2 other things where there's multiple physicians using protocols I put together. One was a 5-year NIH National Institute of Health research study on integrative oncology, where I was in charge of the IV therapy part. And the other is an ongoing collaboration I have with a hospital that does integrative and standard therapies together. And so for some things, such as intravenous artesunate with vitamin C or intravenous curcumin, for example, we're, if we look at all of those sites, we're somewhere around 10,000 doses of those things with people. With vitamin C, because I've done it a lot longer, it's well over 100,000 doses, or probably over 200,000 doses of that if you look at it all over. And so the conundrum that we have with people is, as we mentioned at the top of the show, they'll go to the oncologist. The oncologist will say, well, this chemo drug for your type of cancer has a 50% 5-year survival rate, and that's because they've looked at it for 10 years, et cetera. Up until recently, we haven't had a lot of survival data on integrative oncology things because it was hard to get someone to pay for that sort of research. What is coming out now from the research that we did in America, funded by the NIH, is coming out very slowly, and that's because there's statisticians and other people involved. But what I can tell you from looking at our data there, when we look at survival of the same type of cancer, so somebody had, let's say, ovarian cancer, lung cancer, breast cancer, and they did just standard of care, or they did integrative oncology care, and most of were in our IV section, we would see that their survival would far outperform the standard survivals that people have with those cancers.
And so, we need to take a little quick break.
Okay.
And this is something that I'm really fascinated about. So we'll be right back with Dr. Paul Anderson. Welcome back. I'm here with Dr. Paul Anderson at HealthMade Radio. Dr. Paul Anderson is the author of the book Outside the Box, Cancer Therapies. Dr. Anderson, you were mentioning some of your clinical anecdotal experience that you have in regards to vitamin C, and people always think that, well, this is not proven, it's not been tested, it's not effective, but you mentioned that you've actually been involved in about 100,000 plus doses of IVC and thousands of things like artesunate, curcumin, and so this is something that's really legitimate, and you see impact in people using these therapies.
Yes, and I think to put a point on that, what we usually tell people is, while we have some preliminary data from some of the actual funded research that was done, and we can show some survival changes, et cetera, we don't. Although we have this large volume of anecdotal evidence and clinical experience, we can't hand somebody one paper that says this is the definitive survival rate for vitamin C versus curcumin versus anything else. But the other side of that is that unless someone thinks I'm lying about my experience or something like that, what I can tell them is, if you come in with a solid tumor, like ovarian cancer, something like that, we're more likely to start with vitamin C or artesunate vitamin C, because historically it's worked the best in that group of patients. If you come in with a leukemia or lymphoma, we may do a little vitamin C, but we may do a different direction of the IV therapy, because we've seen different things work with the blood type cancers than we do with some of the solid ones. So there is emerging a way to sort of direct that. In the IV therapy chapter, which I was the primary author on, I tell a lot of the backstory of that and how we got to that. And then when you get to the therapies chapter, when you see us say, our first choice for IV therapy would be these two things, it's because over all these years, those are the things clinically and anecdotally we've seen work the best. So we tried to put a lot of that in the book to give people a place to start, along with all the scientific references.
And how the scientific references, so these are things that it's not just your thoughts and feelings, these are things that are actually based upon a lot of research.
Exactly. And while there might not be large-scale studies saying we gave 10,000 people curcumin and this is what happened, although those are coming, we have over 1,000 scientific references. So we reference pretty much everything we say in the book. And we did that actually for the person's healthcare provider, so that if they're interested in looking into it more, the references are there. They don't have to go looking for them. If they're skeptical and they say, well, there's no research, they can be shown that, for example, turkey tail has over 400 references published on it. They're not all in the book, but just we mentioned that, and so we put all the good ones in. But the references are there to make the patient feel more like this is not just something we made up, and to make their doctor and healthcare team realize that there's something behind this.
And just so the listeners get a feeling of what a integrative therapy can do, just in a minute, what does vitamin C do to cancer?
Yeah, vitamin C in a real short instance, in high doses in an IV therapy, it actually creates chemistry that damages cancer cells and leaves the normal cells alone, and may even be supportive to normal cells. So vitamin C is one of those things we do a lot of, because it's sort of the perfect agent, where it's most likely going to weaken a cancer cell, and it's at the same exact time it's most likely going to strengthen a normal cell. And so it makes it sort of the ultimate type of a treatment.
And it's actually when you do a higher dose, it becomes an oxidative therapy, which can be done conjunctly with any chemotherapy.
Certainly, yeah, and that's an area where I've done a lot of research collation over, and I've published on that so that doctors can be comfortable with that. It's very compatible with almost all chemotherapy.
Wonderful. Well, I so appreciate you on the show. You're just a wealth of knowledge in this area, and I want all the listeners to be sure to check out his book, Outside the Box Cancer Therapies, Alternative Therapies that Treat and Prevent Cancer. It's information that truly can be life-saving for yourself or someone you love. Remember, according to statistics, you have almost a 50% chance of being diagnosed with cancer. Get the book and learn your options now. Thank you so much, Dr. Paul Anderson, for joining us today. I so greatly appreciate your work in forwarding integrative cancer research to establish proven nutritional therapies designed to potentiate medical care and support the establishment of health while facing cancer. Thank you so much, Dr. Anderson.
Thank you.